Welcome back to Morning Joe. Joining us now, former FDA Commissioner Dr. Scott Gottlieb. Dr. Gottlieb, great to have you back on the show this morning. We've been talking about single-day records in cases yesterday in California, Texas, and Florida, representing obviously huge swaths of the American population. What can you tell us about why we're seeing those spikes, number one, and number two, what can be done at this point to mitigate those numbers?
Well, look, we reopened against the backdrop of a lot of persistent spread in those states, so it was inevitable that cases were going to go up. I think they've gone up more than most people expected, and I've certainly been surprised by the acceleration in the cases as well. I think most of us were. Right now, there's a lot of spread in these states. A lot of this is in a younger demographic, and the fact that we're capturing these cases, people are presenting with illness, and also younger people are being hospitalized right now at a higher proportion, suggests that there's a lot of infection underneath these cases. And so I think that these states, Texas, Florida, Arizona, California, even South Carolina, Alabama, Arkansas, I think they have a lot of spread at the community level, and it's going to take time and it's going to take more aggressive steps to try to snuff this out. Whatever they do right now isn't going to really have an effect for 2 or 3 weeks. We saw in New York City, they peaked in the number of, they announced that they were doing the shutdown March 20th. They didn't peak until around April 7th in the number of cases, almost a full 3 weeks later. So what the steps we take right now really aren't going to have an impact for another 2, maybe 3 weeks.
So Governor Abbott of Texas said a couple of days ago, not in an order, but when he was talking in an interview, that Texans should stay home unless they need to go out. What would you say if you were advising the governors of those big states that are seeing spikes again? Should they shut down businesses again?
Well, look, they're not going to shut down business again. That's the bottom line. I don't think that there's a political will to do it. I don't think the populations of these states would tolerate broad shutdowns. I think what they need to do is figure out where the spread's occurring, what the congregate settings are where the spread is actually occurring at the highest rate, and target interventions towards those venues. So if it's spreading in bars, they might have to shut down bars. The other thing they need to contemplate right now is in some parts of these states, they're going to press up against their hospital capacity. It's not what's happening today. It's what's going to happen 2 or 3 weeks out. And you have to believe that there's a lot of community spread already in these states. It's going to continue to build, and hospitalizations will continue to build over the next 2 or 3 weeks, even if they start taking aggressive steps today. So if their hospital systems are pressed right now, they're going to need excess capacity in 2 or 3 weeks. They need to start taking steps to enable that. And so you look at some cities like Houston, all of Arizona really, are getting pressed, even Miami-Dade. Now, certainly states like Florida and Texas and California have a lot of excess capacity, but there will be parts of those states, some cities, that do start to get pressed. And so, for example, the Texas Medical Center predicts that in the next couple of days, they're going to have to go into what they call sustainable surge capacity. And then within 2 weeks, they'll have to go into what they call unsustainable surge capacity. And so you need to start making accommodations now to provide for that.
Dr. Gottlieb, in states like Arizona, Florida, Texas, California, they're sort of struggling with some new record numbers. For any entity planning on having an indoor event that's several hours long, over 500 people sitting close together, mostly not wearing masks, what are the chances you go to an event like that and you come home and you're fine and your family's fine?
Well, look, the prevalence nationally right now is probably about 1 in 200. So 1 in 200 people are infected. You figure half of those people are aware they're infected or symptomatic and not going to go out. That's probably a high number. So maybe the actual prevalence is 1 in, figure, 300. In these states, it's higher. So if you go into a big congregate setting like a 500-person setting in an indoor venue, there's going to be infected people in that crowd. And so indoor settings for sustained periods of time are high-risk venues. So you could have spread coming out of those kinds of venues. I would not be going into those kinds of settings right now. Even in the Northeast, quite frankly, where the prevalence is much lower, I would avoid those kinds of settings.
And what about going to the doctor, to the dentist, to the gynecologist? Are you still advising that people put those appointments off if they don't have to go?
No, I think people should be trying to seek elective care right now. I mean, certainly in states like Texas and Florida, where there's outbreak situations, in cities like Houston, you need to be more mindful of that because the prevalence is high. But here in the Northeast, I think people who put off elective procedures should go out and get them. And in fact, I went to the dentist. I had my annual physical. I think this is an opportune time to do that because I worry that things will get worse in the fall. Right now in parts of the country like the North, like the Northeast, even Northern California, the prevalence is probably as low as it's going to get for a little while.
Mike Barnicle.
Dr. Gottlieb, apparently a significant percentage of people infected by the virus never show any symptoms. What do we do about that if it is true? And does this happen among a specific age group or younger people or older people? What about that?
Well, it appears that younger people are more likely to be asymptomatic. So anywhere from 20 to 40% of people are asymptomatic. There is some suggestion that people who are asymptomatic are less likely to transmit the infection, although we're not sure about that. This is true of a lot of viruses where you could get asymptomatic disease. Even with the flu, about 15% of people who get influenza are asymptomatic. It's higher with COVID, and that's what makes this illness difficult because a lot of people are asymptomatic or mildly symptomatic and still can transmit the infection. And actually, the period of time in which you're most contagious is 0.7 days before you develop symptoms. So you're actually most contagious right before you develop symptoms. And so this is why this spreads so efficiently.
All right, Dr. Scott Gottlieb, thank you very much once again for being on the show this morning. And still ahead, the Trump administration is cutting off funding to coronavirus testing sites in 5 states, including the home state of one of our next guests. Senators Dick Durbin of Illinois will join us. We'll ask him what's next for police reform, too, after Democrats blocked a Republican bill on the issue. Morning Joe is back in a moment.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.